This is the
Okay, so again, this is the uh, lesser trochanter, not the greater one. This is the greater one, but this is the lesser one. What muscle attached in the lesser trochanter of the femur?
So it is for me. Oh,
For anyone,
iliac.
iliopsoas.
okay.
iliac-
So it is iliopsoas muscle.
iliopsoas, which is
ili-
consisted of iliacus and
Iliacus and psoas major muscle.
Was major.
do you know what is the psoas major nerve supply?
It's take blood. It's nerve supply from the psoas muscles. It's taken from the lumbar L1, L2, L3, L4.
L1 to L3.
So, okay, regarding psoas muscle, we have first we have the origin and insertion. What is the origin of the psoas major muscle?
It takes
T12, L1, L2, L3.
No, you have to divide it into superficial and deep
Superficial
organs.
and deep. Okay.
Okay.
The superficial is
So-
from T12, L1, L2, L3. Then the deep is from L1, L2, L3, L4.
Okay. So again, it will originate from transverse process and vertebral bodies of T12 to L5 if you can do it as a whole one. And it will move inferiorly and laterally deep to the inguinal ligament to attach to the lesser trochanter of the femur. The innervation is anterior remi of L1 to L3. Anterior remi of L1 to L3. The action is a flexor of the thigh at hip joint and lateral flexion of the vertebral column as well. Flexion of the thigh and lateral flexion of the vertebral column. Okay, what is the innervation of the psoas minor muscle? Anterior remi of L1. Anterior remi of L1. What is the iliacus origin insertion nerve supply? Iliacus is a fan-shaped muscle, is
from the iliac fossa.
attached on the iliac fossa. It's called iliacus because it is originated from the iliac fossa and anterior inferior iliac spine, and its fibers combine with the tendon of the psoas major to insert into the lesser trochanter. The innervation is femoral nerve.
The anterior
Okay, what is the psoas sign? What
Psoas-
is psoas sign?
So what sign is
Negative pain.
if the patient hip is flex, the patient will get pain in the IF due to a reduction to the inflamed appendix.
Excellent. So it is elicited by flexion of the thigh against resistance, and flexion of the thigh at the hip joint is positive test when the patient got lower abdominal pain, and this is a medical sign indicate irritation of the iliopsoas group by peritonitis, and it is right psoas sign is indication of appendicitis because the iliopsoas contracts and it comes with contact with the inflamed appendix over the peritoneum, producing pain. Okay. Okay, so upper limb revision, small station. Okay, anyone is ready to answer the full station from now?
Yes, we can.
Okay. What are the boundaries? What is this structure called? This structure called triangular structure here?
Yeah, this is a cubital fossa. It is triangular shape in front of the elbow joint. It is formed by the imaginary line between medial and lateral epicondyle pronator teres and brachioradialis.
What is the border? You said the superior border is a horizontal line connecting the medial and lateral epicondyles of the humerus. What is the lateral border?
Brachyradialis.
Medial border of brachyradialis. What is the medial border, lateral border of
Pronator teres.
pronator teres? And what is
Content.
the roof?
Roof the fascia and subcutaneous tissue.
So skin, subcutaneous fat,
Yeah.
antecubital fascia, and bicipital aponeurosis. What is the flow?
No, it is formed by the brachialis muscles.
Brachialis proximally and supinator distally. What is the contents?
It contains median nerve and brachial artery.
So tendon, artery, nerve, tan.
Yeah.
Tan in the cubital fossa.
Yeah.
Tendon, artery, nerve. What is the tendon? Biceps
And the
tendon.
bicep tendon.
Okay. And what is the attachment of this bicipital tendon?
To the radial tuberosity.
Tuberosity, radial tuberosity. About the brachial artery, what is the and tan a artery, brachial artery bifurcating into radial and ulnar arteries at the apex of the fossa. About the median nerve, it is tendon, artery, nerve. Nerve is the most medial structure. Okay. And don't forget the roof of the cubital fossa contains superficial veins and especially, most importantly, median cubital vein connecting basilic vein and cephalic veins. Which vein is medial and which vein is lateral, basilic or cephalic?
Cephalic is laterally, basilic.
Cephalic laterally or medially?
Laterally.
Cephalic laterally.
Cephalic.
Okay.
Basilic medially.
Cephalic laterally and basilic medially. Excellent. And what about radial nerve? Is it one of the contents of the radial fossa or no?
No.
It is.
Yes, it is.
It is one of the lateral border of the cubital fossa content, dividing into superficial radial nerve and deep radial nerve, which is called posterior PIN, posterior intercutaneous nerve. Regarding supracondylar fracture, I am going to give you a picture of a supracondylar fracture, and this is a very important question. Supracondylar fracture, it is distal humeral fracture and typically transverse or oblique, and the most common mechanism of injury is falling on outstretched hand. Falling on an outstretched hand. And please know that it is more common in children than adults. What will be affected? The contents of the cubital fossa can be damaged, either directly or soft tissue swelling and trauma. What happens if it is not repaired? This is a new question. What happens if it's not repaired? This supracondylar fracture in a 11-year-old child. Do you know what happened in one of them?
Yes. If it's not repaired, so we can cause a compartment syndrome in the lower limb, in the forearm.
Volkmann
ischemic contraction.
VIC. Volkmann's ischemic contracture is uncontrolled deflection of the hand. Uncontrolled deflection of the hand as the forearm flexor muscles become fibrotic and short by this fracture. So again, the forearm flexors muscles become fibrotic and short. This is called Volkmann ischemic contracture. And don't forget, what is the most common branch of a nerve injured in this supracondylar fracture? Do you know?
Median nerve.
No.
Sorry, what's the question?
What is the most common nerve affected in the supracondylar fracture?
It's ulnar nerve.
No,
Just posterior interosseous.
no.
So let's,
Radial nerve.
yeah. Mm.
Most common nerve injury in supracondylar fracture.
So musculoskeletal.
Is
AIN,
the
anterior interosseous nerve. I don't think.
Mm.
Have you passed part A? I now suspect that you are going with, yes, thank you, Dr. Tom, Dr. Gul, because now I suspect you that you skipped from part A and coming to go for part B. Really, because in the question posting, we told that the supracondylar fracture, the most common nerve, 9%, 95% is the AIN, anterior interosseous nerve, is the most commonly affected by the initial injury, but later on, ulnar nerve palsy uh, could be a post-operative complication, radial nerve or medial nerve. So you can have uh, uh, any one of these ones. Okay. What else? Okay. What is the nerve supply? Do you know what is the nerve supply of front of forearm? Hmm?
Superficial flexures are supplied by the median nerve and the deep
برضو
flexors.
you haven't attended upper limb lecture anatomy. The front of forearm supplied by median nerve, apart from
Flexor carpi ulnaris, which is supplied by the ulnar nerve
and medial how flexor.
of flexor digitorum profundus.
Okay, what is the what is the nerve supply of intrinsic muscles of hand?
النير.
Ulnar.
Apart from ما تكملوا الجمل. ما هو بص
Apart
هيبقى
from
الإجابة
the
غلط.
lateral, yeah. It's just
لواف.
Medial.
Apart from لواف muscles. لواف muscles are intrinsic muscles of the hand but not supplied by the it is by the way it's mentioned in like LUAF is like all muscles of the intrinsic muscles of the hand supplied by the ulnar nerve apart from LUAF, lateral two lumbricals, opponents pollicis, abductor pollicis brevis, and flexor pollicis brevis, supplied by medial
median.
nerve.
Median nerve.
Okay. And what is the supply of the thinner muscles? Nerve supply of thinner muscles.
recurrent branch of the median
Recurrent
nerve.
branch of median nerve. Excellent. Okay. Okay. Next time for anatomy of the trunk, we will be live to discuss it live because it's not that complete. And I need you to be alert for anatomy. Anatomy is very nice, very clear for anyone. Just read repeatedly, read quickly and repeatedly. Then you will find yourself excellent in anatomy. Again, last warning for all of you. We should study anatomy very carefully. They are easy and they are uh, collecting marks without any effort, not like pathology. Pathology is very exhausting, but anatomy is very, very nice to study. So better to study the anatomy and better to have 100% anatomy uh, because it's easy. Okay. Next lecture as per schedule will be live as well. Okay. Do you have any question for me?
Please, I want to get the arrangement of the structures in the popliteal fossa, medial to lateral again. I think I got confused.
So, no, NNVA. NNVA. I will open the popliteal fossa for you now.
Okay.
I shared it to the group and I will read it from here as well. I shared it to your group. Have a look. You will find that there is NN, nerve, vein, artery, from superficial to deep and from lateral to medial as well. So see here. Okay. Couldn't here, we can do it on the other picture. Okay, so from lateral to medial, this is lateral, one nerve, this is common peroneal, another nerve, what is this?
Tibial nerve.
Tibial nerve. Vein, this is popliteal vein, and this is popliteal artery. So flow from, again, I'm telling who asked it, now again and again and again. This is, okay, this is from lateral to medial, and it
Okay.
is the same arrangement from superficial to deep. So if you will put your hand, the first thing you will touch is nerves. Second things, by your hand more deep is the vein, the deepest is the artery. Okay.
Okay.
But from lateral, it is the same arrangement for the funny arrangement NNVA. Nerve, which is common peroneal. Nerve, N, common tibial. Vein, popliteal vein. Artery is, deepest is what? Popliteal artery is the deepest and most medial structure. Is it clear for all?
Yes. Thank you, sir.
Okay, thank you so much. Next lecture as per the schedule. As per the schedule. Okay. As per scheduled. As per scheduled. Okay. Thank you so much. I hope you enjoyed and keep in touch. Thank you. Shukran.
Thank you.
Thank you.